Hello and welcome to McLaren Port Huron's Today's Health Program. I'm your host, Michelle Baker. Today I'm speaking with medical oncologist Dr. Samir Alsawah about lymphoma. Dr. Alsawah, thank you for speaking with us today.
Thank you for having me. Pleasure.
Now let's begin with what is lymphoma?
Lymphoma is an abnormal growth of the lymphatic system of the body. If we can have the picture here, this is the picture of the human body, and you can see in the green, all these greens are lymphatics. What the lymphatic is like a vascular system, just like the blood, but it carries different liquid called the lymphatic liquids. Their job is to be responsible for our immune system. They fight everything bad that could happen to us, from viruses to bacteria to cancers to other things in the body. And they are, as you can see with the green vessels here, they're all over the body. They're not really only limited to a specific organ or a specific area. And along this path of the green vessels, you see little nodules. You may not see it on the camera, but they're little nodules. We call them lymph nodes. They're like filter stations to filter out anything that goes bad with the lymphatic liquids. So, but like anything else in the body, that particular system which is made to protect us, sometime that system can go bad and it will cause a cancer. Instead of calling it lymph node cancer, it's given the name lymphoma.
Now, is there more than one type of lymphoma?
Absolutely. Actually, there's about 80 different kinds, but they are lumped together into two major types. One type that's called Hodgkin's and one called non-Hodgkin's lymphoma. The majority of lymphomas out in practice, like about 90%, are called non-Hodgkin's lymphoma. And even that is branched into so many different kinds based on how aggressive they are. But that's the major differentiation.
Now, do we know what causes lymphoma?
We actually don't. I mean, very few cancers that we can actually strongly link it to something. The only link we have, by the way, between cancer and something is smoking to lung cancer. But we have some risk factors. So we don't know what caused the lymphoma for sure, but we have some risk factors.
And what are those risk factors for lymphoma?
Most of them are non-specific, like being male gender, a bit older in age. The older we get, the higher the odds that we could acquire lymphoma at a certain time in our life. Also, being exposed to certain viruses like Epstein-Barr virus or other viruses that can cause a lymphoma. Last but not least, any condition in a body that can weaken our immune system, like organ transplant. Basically, those patients like kidney transplant are receiving immune suppressive therapy for their life. Their immune system is weakened, then lymphoma can start. Or rarely condition like rheumatoid arthritis, lupus. Sometimes patients with those conditions have a little bit higher tendency to develop lymphoma.
Now, it sounds like there are not very many modifiable risk factors. Is there any way really to prevent lymphoma? Not really. I mean, we also sometimes we tell people to be healthy and to not being overweight. Also, sometimes we think some data that being overweight can be a risk factor sometimes. So just eat healthy and not lose weight. And but really, there's nothing anybody can modify their risk not to have lymphoma. Doctor, this is great information. We need to take a break. We'll continue in a moment.
Thank you.